Hello, everyone. Welcome back to another episode of Industry Insights. I'm Varin Senthil, and today we have Mohan with us. Could you can you introduce yourself, please?
Yeah, my name is Mohan. I'm a fourth year medical student at the University of Chicago. I'm applying into internal medicine and eventually see myself as a physician scientist practicing medical oncology. And I'm from the Chicago area, grew up in the suburbs, and went to college at UIC, and now I'm at University of Chicago.
Could you describe what medical oncology is?
Yeah, so medical oncology is a clinical specialty in the realm of internal medicine. So, medical oncologist is the doctor who spearheads chemotherapy and basically comes up with a plan for the management of patients with cancer. Um, a lot of cancers fall in the realm or under the area of medical oncologist practices. Common ones include like breast cancer, lung cancer, pancreatic cancer, and so on. Yeah, so as a medical oncologist, you're trained in like the most up-to-date evidence for whatever chemotherapy regimens are most appropriate for a person's cancer diagnosis. And on the more like artistic, emotional side of medicine, you get to work with patients who are at their sickest. You get to form long-term relationships with patients, and you are basically like the quarterback of the team that leads the care of um, patients with cancer. And you also work closely with radiologists, pathologists, surgical oncologists, radiation oncologists, and a lot of other specialties too. So a very interdisciplinary field and get to interact a lot with other professionals, but also a lot of patient interaction as well.
Okay, thank you for that. I do
Mhm,
have two questions regarding that.
mhm.
My first question is, by cancers, does that include benign tumors or is it only malignant?
So that's a good question. I think it really depends on the area. Generally speaking, a patient goes to their primary care doctor, the doctor they see like 6 months, every 6 months to a year. If there's something wrong there, something that looks a little suspicious, then that doctor would refer them to get more scans or refer them to a specialist. And usually that specialist is the medical oncologist if it's some kind of suspected cancer. So oftentimes patients come to a medical oncologist with a diagnosis. And so if they got a scan and they found something funny on the scan that looked like a tumor or something suspicious for some kind of cancer, they would see a medical oncologist. And so benign tumors can fall under the practice of a medical oncologist. Depending on the kind of tumor and where it's located, the medical oncologist can decide like should we do something about it? Should we just wait and watch, or should we, yeah, just leave it indefinitely and no need for any kind of concern? So those kind of things can also be managed by a medical oncologist, but it just really depends like where you are. But yeah, generally they manage a variety of benign and also malignant conditions. Yeah.
Okay, thank you. Another question, the second question I have is do you
Mhm.
recommend or do you think an introvert does it really matter if an introvert or extrovert like wants to go to that field?
No, I mean, I think medicine as a field is very patient oriented. Like you talk to a lot of people, you talk to like your fellow colleagues. Like I mentioned, as a medical oncologist, you work with at least like five other groups of physicians. And then you also talk to nurses and social workers and physical therapists and other kind of professionals. And then you talk a lot with patients. But I really don't think you need to be extroverted to do that. I definitely am much more introverted than extroverted. I think over time you develop strategies to communicate effectively with people. And I think the most important thing for any kind of doctor, and maybe specifically with medical oncology, is just like having some sense of empathy and having humility and really meeting the patient where they're at and making sure everyone understands what's going on and being patient. So I think those kind of things matter much more than being introverted or extroverted. And if anything, like I feel like introverted people are generally good listeners, which goes very far in medicine, especially with developing rapport with the patient. So I found that as an introvert, it's my strengths are often very valued in the medical field.
Okay. Another question I have is when you're trying to determine what you should do if someone has a certain type of cancer,
Mhm.
what's like, is there like a step-by-step process of that, or is it
Yeah.
something else?
So it depends. So let's say someone came in with breast cancer. What happened was they went to their doctor, they got their yearly mammogram. On the mammogram, they noted something abnormal, and then because when you see something abnormal on a scan, you need to take tissue and see whether it's really some kind of cancer or some kind of benign process. So for breast cancer specifically, following along with the example, like they see something on the scan, then they would get a biopsy. So they usually stick a needle in, take some tissue, and look at it under a microscope. And then based on that, they can start to figure out what kind of cancer it is. So even within breast cancer, there's many types of breast cancer, and there's many different stages. So stage is a common way of classifying cancers that guides treatment for a patient. And it really depends on what kind of cancer, where the cancer is located, how far it's spread, as far as coming up with a plan for the patient. But generally speaking, there are a lot of guidelines for the management of patients. So if someone comes in with like a stage one breast cancer, there would be like some kind of plan for them that the oncologist has based on clinical trial data, usually. Sometimes there are cases where like there's no data for it, like not many people have that cancer, we don't really know what to do. And in that case, the oncologist would use their best judgment in line with the patient's wishes also for what they want out of their treatment and come up with a plan together. So there's like it's like a mix of art and science as far as like the science is referring to like clinical trial data as far as what drugs work and what cancers, and then an art as far as like not every patient fits the mold of clinical trial data, and you have to like also keep in mind what the patient wants out of their treatment too. Some patients don't necessarily want to go through the process of getting chemotherapy, especially like if they're older and like there's a cost and benefit to everything. So the oncologist and the patient together will weigh those things and come up with a plan.
Okay, thank you for that.
Mhm.
A question I have is how do you get into the profession?
Yeah, I mean, so the journey to becoming a doctor is like a long journey. So at a high level, you complete high school, you complete college. After college, you can do a bachelor's in anything. You will have to take the MCAT, which is a standardized admissions test, and then you take, while you're in college, you take some pre-medical required courses, and then you apply for medical school admission after you finish college, and then you go to medical school. Medical school is 4 years, and then after medical school, you train and you do residency and fellowship if you're interested in a fellowship. But to practice in the United States, you have to complete a residency. For medical oncology, you do a 3 year internal medicine residency and then 3 year hematology oncology fellowship. So that's the general overview of the path to becoming a medical oncologist. Yeah.
Let's say someone was going to become or like oh, let's say someone would like to do some trials instead, like medical trials. Will they
Mhm.
also do the MCAT?
So clinical trials, it depends what you want to do in clinical trials. So like oftentimes clinical trials are run at big university hospitals. You need a lot of patients to enroll in trials. So you have to be at a place that gets a lot of patients. So oftentimes they run at big hospitals. People who like come up with the idea for trials are often doctors, especially in the cancer world. So like every clinical trial will have some kind of doctor leading the trial. And they'll come up with the idea for a trial, go through all the extensive regulatory process for getting approval, and then we'll run the clinical trial. And yeah, usually there's some kind of industry sponsorship of clinical trials. There could also be government grant sponsored clinical trials, but it depends what you want to do. But generally speaking, like physicians are the one who lead clinical trials, but there's also other people involved with it, like statisticians and then other healthcare professionals like nurses and so on. But to be the person who leads the clinical trial, generally you need to be some kind of MD physician.
Okay. Can you describe what the MCAT is in more detail, please?
Yeah, so the MCAT is a medical college admissions test. It's similar to the ACT and SAT for high school to college. It's a similar concept, but for college to medical school. It has four sections: biology, chemistry, and critical reading, and then psychology and sociology. It's about like a 5 hour exam. And yeah, I mean, it's a standardized test. Every person applying to medical school has to take it. And the scoring range is like, I believe, 472 to 528. And then the average is 500. Most people who get into medical school have like a 510 to 515 on the MCAT. Yeah, I mean, to study for the MCAT, you definitely need at least like 3 to 6 months. It's a hard exam, but it's also doable. And I think once you've taken pre-medical required courses at college, you can definitely start studying for it. But I personally studied 3 to 4 months over summer and then took it right at the beginning of my junior year in college.
So does it matter like what year you take it in college?
Yeah, I mean, it doesn't really matter, strictly speaking. The score is valid for 3 years, I think. So you should time it such that your score will be valid when you apply for medical school. Um, most people take it in their junior year or senior year, or a lot of people also take gap years, so where they do like research for a year and then apply to medical school. So if someone does a gap year, they could also do it then. But mm, generally, like you would have to take like at least 2 years of biology and chemistry in college to be prepared. Like you need a solid foundation in science to start studying, and also the other subjects too, like psychology and sociology. Like you need some foundation in it before you can start studying. So generally, you could only really start studying like after your sophomore or junior year at the earliest. Yeah,
Okay. Um, over your time, like so far, is there a lesson that you've learned?
it's a good question. I mean, I think the journey to becoming a doctor is a very long process, and it's hard to fully appreciate the length of it when you initially start out because you were in college, but then medical school 4 years, residency 3 years, fellowship 3 years. So like even after college, you have like at least 5 to 10 years of training left. And I feel like it's medicine is a field with a lot of delayed gratification. You reap the rewards at the end. And during the training is very rigorous and very like, you have to like keep the motivation you started with in mind. So I think for me, one big lesson I learned is like along the way, because it's such a long journey, like even though things are very busy, I should always make time to do things that keep me personally satisfied. For example, for me, like I like exercising, I like trying new restaurants, exploring big cities. So finding personal hobbies that I can keep up with even when it's extremely busy, and that's been something that's been particularly important for me to realize. Yeah, life goes on even though you're a medical student and a resident, so you should make time for normal life things and keeping in touch with friends and family and so on. Yeah.
Okay, so my next question is there any advice you give off to someone who's just getting into college that's planning on going to the medical field?
Yeah, I mean, I think early planning helps as far as like applying to medical school and being ready and being a competitive applicant because obviously getting into medical school is hard. But I think for just starting out college, I think the biggest piece of advice I would say is like just get connected with the resources available on campus early on. So most colleges have like a pre-medical advising office, they have other kind of professional advisors, but there's a lot of small steps that have to happen along the way when you apply to medical school, and getting a sense of that early on is really helpful. So like things that are important for medical school applications are like shadowing, volunteering in a clinical setting, research, and then obviously doing well in school. So starting on those things like earlier could be helpful. But the main thing is to just understand that it's a long road to get into medical school, and there's a lot of things that have to fall in place. And the earlier you start planning for that, the better off you'll be. But at the same time, you should find balance. Like there's no need to work all day every day from like day one. So finding balance, but also keeping in mind the big picture is important. Yeah.
For my final question, I was
Mhm.
wondering if you would do anything differently.
Um, it's a good question. I think I don't know if I would do anything differently. I think for me personally, I found like happiness and fulfillment in the professional journey that I've taken. I think I don't have any regrets professionally. I've taken risks. Like, for example, this year I decided to take a year off from medical school to do research full time. It's been a challenging year, but I don't regret it. Um, I think though maybe something I would do differently is just realize earlier on, like, you can't just like work all day every day. Like you should have to find balance in your personal life too. So putting more effort into personal life, I feel like maybe is something I would have done differently. But well, for the most part, I don't really have any regrets. Yeah.
Okay, well, thank you for sharing your insights on this.
Hmm.
I hope you have a great day.
Yep, you too.
Bye.
Yeah.